The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with the News Society, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. Very pleased to welcome back onto the show Dr. Markus Roggen. Markus is the founder of Complex Biotech Discovery Ventures, which is a licensed cannabis and psilocybin research lab. Markus, welcome back. How are you?
Thank you for having me. I'm good. A lot has happened since we spoke last, and I hope we get into this.
Yeah, absolutely. I'm really glad that you've come back. You'll be talking mainly about mushrooms, but going to get your kind of chemistry head onto psilocybin and a few of the other psychedelics that people are looking at with renewed kind of optimism in relation to medicine. Why don't you actually just tell us about, you've had a few corporate developments since we last spoke though.
Yes, sure. So we spoke last year and we spoke about our research in cannabis extraction and general cannabis analytics. And why we are located in Canada, because there we can do all this research in a licensed setting. And that is the foundation for the new development into mushrooms, because Canada has now a legal framework to do mushroom research, psychedelic mushroom research. And we actually acquired a license to do such research. And that license and our background in being a profitable, successful cannabis company spurred the interest of the new psychedelic mushroom stocks and companies. And so one of those companies acquired us, or is about to acquire us, right? This is a lengthy process, as you know, as a lawyer. So I think by the time this podcast comes out, deal is done, and we are now part of Delic Corp, a psychedelic mushroom conglomerate.
Fantastic. Very exciting. Have you found that, is that going to expand your team and all those sort of things as well?
Yes. As I explained last time, we are a research lab that is purely focused on just the research and development. We are not really eager to do any production or sale of cannabis back then, and that still holds true for psychedelic mushrooms. But we are a perfect support staff for production of those compounds or products. And we have our expertise in chemistry, and there are so many other aspects to the cannabis industry or the psychedelic industry that we can cooperate with quite well. So being part of a larger conglomerate of companies under Delic Corp really helps us to expand our reach and be the in-house R&D arm for the other parts of the company.
Fantastic. Lots of exciting stuff ahead. And yeah, you're right. It does take a bit of time to get all the paperwork done. So hopefully that's nearing an end. So we're here on the show today to talk a bit about psychedelics, in particular mushrooms. So psilocybin is an area that you guys are going to be looking at in your research. And we were looking at it from a chemistry perspective rather than a medical, but hopefully you can give us a bit of an overview on some of the exciting areas. And obviously there's tends to be a lot of crossover between people involved in cannabis in psychedelics. So I thought this is a useful show for the audience. But just before we get into the meat of the topic, for those that haven't listened to the previous episode, maybe you can give us a bit of a background on yourself.
Sure. So I'm German. I'm a chemist. I did my PhD in organic chemistry. Then I had a postdoc in the US in physical organic chemistry. Serendipitously ended up in the cannabis space, where at first I built an analytical laboratory in California. Then I was recruited over to the production side, where I then set up a extraction and production laboratory for a vertically integrated cannabis company, again in California. And in both positions, I really enjoyed the research aspect, the unknown part of cannabis, which is more than the known still.
Yeah.
And I found that within a production company, you have limitations on what you can research, because in the end of the day, you just have to keep the machines running. But I enjoyed setting up the machines way more than keeping them running. So in 2018, I decided to move away from California and go to the rainy Pacific Northwest here in Vancouver, because in Canada, you can do cannabis research in a federal legal setting. which you can't in the US. And while there are legal countries for cannabis in Europe, they are lacking the production capacities. So I wanted to position myself in Canada, where I can do legal research and I have all the supplies I need from Canadian cannabis producers. And as we all know, they have so much overproduction and stored stuff that I get my research material very, very cheaply now. So I partnered up with a professor at University of British Columbia, and we set up a private research lab and started researching cannabis production questions. So extraction, in-process analytics, synthesis. So we do quite a lot of fun chemistry stuff in cannabis. And it was this licensed setup that allowed us to expand into the psilocybin space in late 2020.
Brilliant. And have you found that sort of change up and move from cannabis into psilocybin?
Yeah, so I think after 2020 lockdown and your initial buying to have, there was this initial run on buying cannabis because cannabis is best consumed alone and at home. So it was like the perfect product for the lockdown. And when the lockdown drags on, all the mental illnesses come up, all the PTSD and so on. And so that's when then the mushrooms come in as they are a potential treatment for psychological issues. And it was in 2020 that Canada really established a clear route to a licensed research setting for psychedelic mushrooms. And so we scooped one up. We acquired a license and could start doing mushroom research in December 2020.
Right. Wow. So not that long ago, but yes, very right in the heart of COVID territory, time-wise.
Yes. It has been a tough year, but it has been an eventful year, and luckily we came out on top. We have a small lab, and with the right protocols and a stripped down team, we were able to keep operating the lab year round. It's just not 5 of us in the lab every day. It's more like 2 or 3, and we're rotating around, but we made it work. And normally we want to talk about parallels between cannabis and psychedelics, but we actually can talk about psychedelics and COVID crisis, because while everyone experienced supply shortages, the car industry, bike industry, and so on, we have the same problem in mushroom research. Getting hold of licensed psychedelic material or licensed psilocybin mushrooms is really hard. There's a bottleneck everywhere. We are one of the few research labs, and there are very, very few licensed dealers that can actually produce the mushrooms for us. So while I could buy it around the corner in downtown, I can't use that material for my research because it's not within the licensed system.
Right. That's interesting because, I mean, mushrooms are incredibly easy to grow, I think, aren't they?
They might be growing wild around the library of UBC, but I wouldn't know.
To officially get your hands on it, it's a bit more difficult, I can imagine.
Yes. Yes, so the Canadian system is basically built on having a control of supply so that they know how much material is around and who has that material at any given time. So there's a lot of paperwork involved with it, but it also helps us because it means there's little competition. We have a license, not many others have. We can handle the material. We just finished a research project, and maybe we can get into that later. But I need to, at the end of the research project, you need to destroy the material. We still had 2 grams of psilocybin left. That has a market value of like $10,000. And we just dumped it into a bucket of bleach and had a webcam with Health Canada officials watching us destroying it. Because project was done, that material had to go. I couldn't use it for any other research.
Oh, sounds like a shame. Cool. Okay. Well, look, let's get into the actual topic then. We sort of go into, before we kind of dive straight, deeper into psilocybin, maybe we have a bit of an overview of psychedelics in general. Similar to cannabis, there is a history of psychedelics being used across the world. Have you got a little bit of an overview of how it's been used before in therapeutic settings?
Sure. So if you look into the archaeological records, you can find hints of the use of mushrooms and likely psychedelic mushrooms for a long, long time. There are even like stone sculptures that, depending on how you look at it, look like a phallus or a mushroom, but I was assured they are mushrooms. And they have been used across the world in religious or cultural settings for a long, long time. There's the consideration that Oracle of Delphi delved into psychedelics. You have the shamans. Yeah, you have the South American use, or the area of South America using psychedelic mushrooms. You have that throughout the record. You still have it nowadays, right? While it is mostly banned substance or banned substances around the world, there are some exemption for religious uses. So it comes from that. And so we're talking about psychedelics because they are all serotonin receptor targeting molecules. So, and the serotonin receptor leads to some visual and cognitive alterations. So it is a quite obvious effect, right? You see colors. And actually, our research is like making colors, so we can maybe talk about that too. But yeah, so widespread use, it seems to, if there's a substance that makes you high, impairs you, or gives you any other form of buzz, humans have found it. And mushrooms are one category of it, yes.
Yeah, for sure. And they were studying it, weren't they, sort of post-war, I think, in a more kind of lab setting?
So I'm not a medical doctor, so I'm not the best expert to speak about that. But it has found a new interest, particular now that there's a bit of movement into a legalization of these substances for treatment of PTSD or other psychological conditions. So depending on which war you talk about, PTSD treatment might fit into that.
Yeah, thank you for that. So look, there's quite a few different types of psychedelic substance that people are talking about now in relation to the sort of new psychedelic medicine movement. And you said there's broadly 3 buckets, but some of the substances are psilocybin, LSD, DMT, MDMA, ketamine, ibogaine. I think those are the main ones that I've seen. And what are the sort of 3 buckets that those fit into, and how do they differ from a chemical perspective or chemistry perspective?
Yeah, so thank you for asking for the chemical difference, not the treatment difference. So we can put these serotonin receptor targeting molecules into 3 structural buckets. So tryptamines, these are your DMT, your psilocybin. They are based around a tryptamine scaffold. Then you have the phenylethylamines, so that's mescaline, which comes from a mushroom, or also ketamine is a bit different here. But MDMA, for example, would fit into that. And then the third one are the I'm probably bodging that, lysergamides. So that's LSD. So you have these 3, tryptamines, phenylethylamines, and then lysergamides. Yeah, and these are the broad 3 strategy compound classes that do the work. You then have the natural compounds, psilocybin, mescaline, and then you have synthetic derivatives of that, DMT. So that's when I think LSD is kind of synthetic by now. So as you have in cannabis, right? You have your cannabinoids, and then you have the synthetic cannabinoids, and you also have natural occurring serotonin receptor molecules, and then you have the synthetic that are somewhat similar to it and do a very similar job within a very legal framework.
Great. Well, let's drill down on mushrooms. Before we kind of go into psilocybin, you also made the kind of good point that we've got, obviously there's mushrooms that are the vegetable that everyone eats and they can get from the grocery store. But then there's also a kind of middle bucket of mushrooms that are being sold as supplements that aren't banned substances, things like cordyceps and reishi. And how are you seeing all of those different varieties?
Yes. So the quick cannabis analogy would be hemp and cannabis. So you have something in a legal setting that is very similar and has the whole storyline fitting, while you have cannabis, the illegal or restricted compound, and you have then a similar setup in the mushrooms. Yeah, so we all know gourmet mushrooms, and we do enjoy. Then functional or supplement products like cordyceps, they have compounds of interests that might or might not have some medical aspects. So it's a bit like CBD, which is the fairy dust of all compounds. And then you have the restricted compounds, psychedelic mushrooms with psilocybin. And the psychedelic mushroom industry is very much in its infancies. You have some stocks being publicly traded, but there isn't really an industry for it yet. So it's very similar to the very early days of cannabis. And what I see a lot of these public companies have, and I try to not name which stock does what, but you see that companies that brand themselves as psychedelic mushroom companies also have a secondary arm of functional mushrooms, of supplements, because that's the only way they can actually generate any revenue. There's one company that is like, hey, we are the leading psilocybin company, and we also sell mushroom teas. And they're obviously two very different mushrooms. They have nothing to do with each other because of the legal setting. So you see that companies that are interested in psilocybin mushrooms also look into functional mushrooms. And so our research lab then considers that too, right? Psilocybin mushrooms pose a research question for us, right? How do you extract the compounds of interest? How do you analyze the compounds of interest? How do you even treat the mushrooms, right? How do you dry it right? How do you mill it? All these questions. But experiments use up material, and psilocybin mushrooms are rare to get hold of, and they're very expensive. So functional mushrooms are for us the perfect research stand-in for our work. We develop analytical methods for these functional mushrooms, very much like we do for psilocybin mushrooms. Because I think if you are making a supplement, you should also sell a bit more than just wood dust, which, right, there was the story that is sometimes quite prevalent. So we therefore offer analytics not only for psychedelic mushrooms, but also functional mushrooms. And it teaches us the trade, right? How do we treat mushrooms? How do we mill them? And we do that all on the cheaper, more available functional mushrooms, and then translate that into psychedelic mushrooms too. So it is a fitting combination for a public company, as one is the revenue and the other one is the great blue sky value proposition. And for us, it's the ability to do the basic research and training us on mushrooms, doing it on the cheaper functional mushrooms, and then we translate it all to psychedelic mushrooms.
Yeah, it's great to see there's some value there in the function that you can bring over to the psilocybin. Also good to identify the hyperbole in this industry. As an aside, I got sent a pitch deck from apparently one of Europe's leading medical cannabis companies, and they hadn't even started building their facility yet. So I think you and I both know the hype that lives in this world, but that's an aside. So if we're going to go into the psilocybin side of things, at a high level, how is that working from a chemistry perspective? And why are people getting so excited about it in terms of mental health?
So you then also see that a lot of psychedelic mushroom companies have, like, again, two legs or two foundations in the psychedelic space, where you see treatment with psilocybin, the compound from mushrooms, but generally produced chemically as a pure substance, because dosing of a pure substance is way easier than guessing how much is in that mushroom. And that treatment seems to be more like a one and done. So you take psilocybin, not the microdose, but like a substantial dose. You are under the influence for hours, and you go through that experience with a therapist or two therapists, because the session takes so long. And then supposedly you are done with your problems. Again, please ask the doctor. And then the other one is ketamine. Ketamine, it's not a compound from the psychedelic mushroom, but it supposedly has similar effects. But ketamine, and you see a lot of ketamine clinics now popping up in the US, and that's more a regular treatment where you have to come back multiple times, and or you're on it for a long time to work through it. And ketamine is actually an anesthetic. It was developed originally as an anesthetic, but it was found to have some potentially beneficial effects on the psychological side. So ketamine is not a mushroom compound, but it fits into the storyline for a lot of public companies. And it is, in the US particularly, way more revenue generating than psilocybin mushrooms that you can't hand out. I know there are now states that legalize or decriminalize it, but they're still way behind where cannabis is nowadays or where ketamine can be.
Yeah. And so what are the sort of main challenges in your research, aside from the normal ones of illegality and difficulty in getting licensed product?
Sure. I think, as I said on the last podcast, my father's a lawyer. He wanted me to become a lawyer. I decided to do chemistry, and now I'm stuck with like loads of law questions and regulatory questions. I had to pick that research field. But aside from that, for us as chemists, we actually can start really, really small. The analytics of psilocybin is actually quite complicated because chemically, because of the amine group and the phosphorus group on the compound, you run into a host of problems. There's the stability issue that the phosphorus group can fall off, which is actually the main aspect of its effect. So psilocybin is the drug you ingest, but psilocybin is not the compound that actually does the work. It is a dephosphorylation that produces psilocin, and psilocin is then the compound that has the effect. So the phosphorus group is actually in the way and prevents the docking. So if that goes and the body does that for you, that's the psychoactive compound. So very much like THC acid produced by cannabis plant, and THC is after decarboxylation is what actually gives you the intoxicating effect. So question is, how stable is it? How can we stabilize it? Or how can we get rid of it? What's the process of it falling off? But also with the phosphorus group and the amine group, you have different ionic states of psilocybin, which complicates the analytics. And there we are going very, very chemistry specific. But if you want to know how much compound is in your material, you are looking for one nice peak and you measure the area under the peak. And it should look like basically just like a line up and line down. A perfect, nice, tight line. If you put psilocybin on an analytical machine and run it in normal conditions that you would use for any other compound, it looks more like a camel back. It's super broad, it has two peaks, and you're just lost, and you can't really integrate that. So you have to actually use different analytical methods and different tricks that you don't bring into your normal analytics, and it actually gives you problems with your other machines. So you can't really do cannabis analytics and psilocybin analytics on the same machine because you're using solvents and columns and that don't really match with each other. So you're constantly switching back and forth and cleaning machines. So you kind of need two machines for that. So that's then one. So for us, right, stability, what are good analytical methods? And then slowly it gets into the question of extraction. And very similar to what research we do in cannabis, it's also the question of extraction for mushrooms. So yes, I said that psilocybin is currently produced chemically for treatments mostly, but we know that psilocybin has other psychedelic mushrooms have other compounds of interest that might have medical effects. So you know psilocybin, but there's also biocysteine, there's norbeocysteine, there's eugenicine, and my pronunciation is probably horrible here. So you run into other compounds that are very closely related structurally to psilocybin, and they are present in the mushrooms. So are they of interest? Is there a synergistic effect? I mean, there are some consumers of mushrooms that say different mushrooms make them feel different. So maybe there is some effect. How do you get them out of the plant? How do you concentrate them? And that research isn't done. And when you look in the literature, there is no agreement. You have extraction times from 15 minutes to 48 hours. I mean, that we have to standardize that. It's for analytic purposes a problem, but it's also for production purposes a problem. Yeah, so these are the questions we handle with mushrooms themselves. And then potentially when we upgrade our licenses. So right now we can only do analytic research because we have a 56 exemption. We are now going toward after a licensed dealer license that would allow us to produce and sell, which we don't actually aim for, but it would allow us to do more research and handle more material. And then we can actually work on drug-like compounds. So can we change the structure of psilocybin or into an analog form that makes it more stable, easier to use, better treatment opportunities? So we want to support the medical community on that side too. So there's a lot in our future and a lot of fun coming our way.
Yeah, it sounds really similar to cannabis then, in that some really quite rudimentary areas that haven't been sort of settled and established yet because it's just so new, or the research hasn't been allowed to happen yet.
Yes, we are really good in doing research on restricted compounds that are under-researched and difficult to study.
Yeah, that's good to highlight, I think. So to round it out, where are you what's the most exciting bit that you're seeing? Is it around drug development?
So drug development is our maybe blue sky opportunity. As I said, we are making colors. So let me just quickly explain that. So as I said, psilocybin actually dephosphorylates into psilocin. So psilocin is the compound that does the work in the body. And so you could think, why are you synthesizing psilocybin? Why are you not just making psilocin directly and give that to the patients? So it skips a step and makes it available quicker. The problem is psilocin breaks down very easily, and it actually breaks down into compounds, or it oxidizes into compounds that eventually actually turn blue. So the compound then appears blue. So when you have psilocybin mushrooms and you injure them, so you cut the stem, they actually eventually turn blue. So you're not only seeing colors, you're making colors. That's where the joke came from. And that then asks us chemists lead to the question, how can we make a compound that is more stable? Right? If your psilocybin medicine has to be made at site and directly given to the patient, that limits the availability and the treatment opportunities. So can we come up with a compound that is similar or near identical in structures with a small tweak somewhere that increases stability so that it can be stored and transported better? Very, very similar to our current problem of COVID vaccines, where some vaccines need cold storage at minus 80 Celsius and go off in a day after you open it. You want it in a pill form and can store it at room temperature. So that's one field. And then there is an interesting aspect that there are some related compounds to psilocybin that don't have a psychedelic effect, but still offer some of the medical effects. So can you make psychedelic analogs that are not psychedelic, but still lead to the treatment outcomes you desire? So that's our blue sky work where we are excited to get into. And on the way, we have a lot of other problems to figure out, as I said, extraction, processing of mushrooms, analytics, support producers with analytical tools that they can use in the field or in their indoor grow facility to ensure that both in the psychedelic mushroom space, but also in the functional mushroom space, they can bring products to market that are within specs and contain the compounds the client or the consumer desires.
Yeah, very interesting. I mean, it sounds like similar challenges to cannabis, really, stability and drug delivery and all these interesting different areas of getting the medicine into you in the right way.
Yes.
Similar challenges, but there comes the excitement as well, right?
Yes. It is fun. And we feel like we have seen it before, but it's also very new. Here in Canada, you have a lot of people that have worked initially in the early phases of cannabis. They're now moving in the psilocybin space. And everyone has their own motivations to do so.
Yes.
Ours is just purely curiosity on the chemistry side.
Yes, good. And I hope we champion that more, actually. Markus, thank you for joining me today. Really interesting. And thank you for giving the chemistry perspective. I think you're right. We should probably get a psychedelic medical professional as well to sort of give us the medical side of things. So we'll do that. But I look forward to having you on again at some point, maybe to talk about cannabis again. Go back to your original calling.
Or we come up with a third restricted substance that is the next hot topic.
Absolutely, yeah. Oh, let me have a think about it. Cool. Thank you, Markus.
Okay, thank you very much.